Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
There are many materials that can be used in the fabrication of temporary restorations, and there are many cements that are available for seating the temporaries in the mouth. However, if we look at the use or the method in which we're going to use temporaries, this may limit what can be used in the fabrication of the temporary. We are going to be dealing with multiple preparations, multiple restorations, so we would need a material and procedures that would enable us to make several temporaries at the same time. Also, if we look at the objectives of a temporary, this will further limit us as to what we can use in the way of materials and methods. The first thing that a temporary should do is to protect the tooth against thermal, mechanical, and chemical irritation. The temporary should also maintain the teeth in their position and also maintain the occlusion. If we take master cast, mount them on the articulator, wax up the occlusion, we would expect the temporaries to hold those teeth in exactly the same position so we can place the restorations back in the mouth and not have to do adjustment of the restorations due to the movement of teeth. The temporary should also maintain healthy supporting tissues. If we start out with healthy supporting tissues, and in the interim our temporaries cause periodontal disease, then we cannot expect the restorations to fit properly, nor the teeth to be in exactly the same position when we go to put the restorations back in the mouth. People need to function on these restorations while the temporaries, while the restorations are being made, so the temporary must provide function for the patient. Also, in the anterior part of the mouth, the temporary must provide aesthetics. So this limits the methods and materials that can be used for the fabrication of temporaries. Now, if we go ahead and consider these objectives of temporaries, the remainder of this film will deal with the fabrication of temporaries, showing you one way that it can be done, the use of cements, and also some tissue response that we might get from temporaries. So the first thing we'd want to do is to look at the fabrication of temporary restoration. During this presentation, we will deal mainly with the formation of temporaries using an Omnivac shell. However, an alginate material can be used similarly to fabricate multiple temporaries. And this alginate impression can be used in a couple of ways. If you're going to use an alginate impression, you'd want to trim away this gingival area a little bit, take away any irregularities that exist in the preparation or in the existing teeth that you'd want to correct. And then you could either make a thin shell temporary. You would paint Duralay inside of this temporary, make a thin shell that you could take out of there, load up with acrylic material and put it to place in the mouth. Or you could take and fill the three tooth areas with Duralay and put the whole impression in the mouth to form the temporaries. The method that we'll use for this situation will be a thin shell that we've made on the Omnivac press. We took a little segmental impression or off of any cast that you have of the patient's mouth. We can use the press to suck down a thin shell temporary or shell that we can use to make our temporaries. So here is the shell on the stone model, and here is the thin shell that we will use to form the temporaries. We'll load this up with acrylic Duralay and put it to place to form our temporaries. We should lubricate the teeth with a lubricant. Let's wash that out first, please. We're using a silicate cement lubricant for lubricating the teeth. It's well to put on a very liberal application of this lubricant. You would not want the Duralay to set or stick to the teeth. We now go ahead and mix a liberal amount of Duralay in a dappen dish. This is a tooth-colored Duralay. You wet the Duralay. To get real accurate margins, you should take Duralay and paint around the marginal areas of the teeth. So while that Duralay is getting a little bit of body, we will take the Duralay on the brush. Would you clean the mouth out there with the suction? Paint a thin layer of the Duralay around the cervical areas or the margin areas of the teeth. This will give you some real definite, accurate margins on the temporaries. The temporaries should be compatible with the gingival tissue. If you cause gingival irritation with the temporary, then this is defeating the purpose. We now load the thin shell that we have with the Duralay material that's in a doughy state. With this loaded, we will place it in the mouth over the teeth. Hand close. The patient can bite on it to seat it in the proper position. Open, please. Close, please. Open, please. Once we have the acrylic to place, patient closes, open and close. We want to gauge the set of the acrylic so that while it's still in the doughy state, but yet not too doughy, we want to take the temporary on and off of the tooth. Open, please. So we want to gauge the set of the temporary so that we can take it on and off. Close, please. Open, please. If you have sufficient time for the set of the acrylic material, you can take a pair of scissors and start trimming away the excess material. Now, this thin shell material will not adhere or stick to the acrylic, so that the shell will come off when the temporary is finished, or the close, please. Open. Now, the portion that we added to the gingival area on the bicuspid did not stick to the original mix, and this is because we have some hemorrhage in this area. We're trying to make a temporary in the presence of a little hemorrhage, and this is not too desirable. But then again, Now I can feel the temporary getting warm, so it's in its final set. We want to have it off of the tooth as it goes into the final set. We can remove the temporary from the shell and trim away the excess flash with a sandpaper disc. Be sure to open the interproximal areas of the temporaries so that the gingival tissue can be kept clean. This is probably the worst area on the temporary, is the proximal areas. These are generally too wide and too thick. Generally, we join the temporaries together because in the later stages, when we have to remove all the temporaries for taking their centric registration, it's much easier to take out 3 temporaries at a time rather than have to take out 3 individual temporaries. The only reason for tying these temporaries together is for convenience in placing and removing the temporaries in the procedure. Once we have the temporary trimmed, we can go back now and correct any of those areas in the mouth that we need to where there's a discrepancy in the margin. In the bicuspid area, where the part that we had around the gingival portion of the tooth that we'd painted in the mouth, as we can see here, did not adhere to the shell part. So now we will go ahead and correct this area in the mouth. We would want to lubricate this well with lubricant, and then we'll paint Duralay on the tooth and put the temporary to place. Close, please. Bite hard. Does that feel like it's down? Bite hard. Open. Close again. Bite hard. Open. Any marginal discrepancy can be corrected at this time by adding Duralay to those areas that are in error and allowing the material to set up. Again, you'd want to take the temporary out of the mouth just before it reached its final set. Close, please. Bite hard. Again, the patient opening and closing would maintain our occlusion while the material is setting. And you can see that the new part that we've added is adhered to the temporary. Open, please. As well to put it to place and take it off a couple of times to make sure that it seats properly. Close, please. Open. And then we can go ahead and trim this area and then add to any other areas that we would deemed necessary. The areas of extreme importance of the temporaries are the margins, the embrasures, and the occlusion. The embrasures are important so that the interproximal tissue can be maintained in a healthy state. The embrasures should be opened, as I pointed out earlier, to give room for the tissue to exist. This is an area where we prevented the patient from going between the teeth with the dental floss, and could cause some periodontal problems between these teeth. So open the embrasure so the patient can get in there with the toothbrush and keep this area clean. This temporary has been worn by the patient for 3 or 4 days, and the tissue looks fairly good. As we would see here, the interproximal areas are fairly good. And noticed on the interproximal area between the molars, these two teeth are quite close together, and we're losing a little bit of the papilla between those teeth. And one of the reasons was because the acrylic extended down into the clavicular areas and prevented the tissue from forming a normal papilla. So I've opened that up this time. You can see the area between the bicuspid and the molar. The tissue looks fairly good. So it's important to keep that tissue in a healthy state. Then the margins of the temporary are important. Again, if they're overextended, they can cause some tissue problems. We would like the margins to be adapted as close as we can to the margins of our preparation. If the margins are underextended, they could cause a sensitive tooth, or more important, they would allow the tissue to grow into that area. Then when it comes to the time of putting the final restoration in, the tissue would have to be pushed back again to get it out of the road. So the margins are important to keep the tissue in a healthy state and also keep the tissue in the position that you would like to have it. The purpose of the temporary is to keep the teeth in the exact same position as you recorded in your working cast. So you need temporaries that will keep the teeth together. If you've got periodontal inflammation around the teeth could be elevated out of the sockets a little bit, and you would have a discrepancy when you went to try the crowns in. Occlusion is an important aspect. If you got faulty occlusion, this can cause traumatic problems on the teeth and also cause the teeth to move orthodontically. So it's important to make sure the occlusion is as good as you can get it. Close, please. Open, close, tap, tap. Make sure the occlusion is good and centric, and also, open, please, close, is good in working, balancing, and protrusive. Move from side to side, please. And out on your front teeth, and back, open. So the occlusion on the temporary should be as fine as you can get it. As you see here, we would like to have the same small areas of contact on the teeth. We would want to not have any balancing interferences. This area should be reduced a little bit to where we have less area of contact. But the occlusion is important in the temporaries, because if you put in a faulty occlusion and it causes the teeth to move orthodontically, then you've defeated the purpose of the temporaries. These temporaries, once you have the marginal adaptation and the occlusion, would be cemented to place. The purpose of the temporary cement is to hold the temporary on the tooth and also to seal the margins against seepage of saliva. In order to accommodate all of the different temporaries that we have and the different strengths in the preparations, we need a series of cements that would have different strengths. So the manufacturers have made temporary cements with different strengths. The right-hand column represents the pounds per square inch of the cement. If you have temporaries with a lot of retention, you would use something like Koch 2200. The purpose of the cement, again, is to hold it on the tooth, but also makes it easy for you to remove the temporary whenever you need to. The Koch 200 is a very weak cement. All it is more or less of a creamy material that would seal the temporary and prevent saliva from going into the temporary, but yet the temporary would have to hold itself in place. The one we use most and fits most situations would be the temp bond. The temp bond has a strength of about 1,000 pounds per square inch. This would hold most temporaries to place. If you have temporaries that can't be held in place by the temp bond, which is 1,000 pounds, then we have a Koch 2200. This is 2,200 pounds per square inch. Generally, we don't need anything with any more strength than this to hold the temporaries to place. So now we can go to the mouth, demonstrate how we cement the temporaries to place. Again, we're dealing with multiple temporaries. The idea behind the cementation procedure is to get all of these temporaries in the mouth without having the temporary cement all over the teeth, all over the mouth. It's quite a procedure for cleaning up the mouth after the temporary cementing procedure. So now we will go through the proper way of cementing multiple temporaries. The cementation of the temporaries is an important aspect in maintaining the stability of the teeth in that position during the time that we're fabricating the final restorations. The idea of the temporary is to keep the tooth from moving orthodontically. This means that there must be excellent occlusion on the temporaries, and that also must be compatible with the tissue, so that we don't cause any inflammation in the tissue. If we cause inflammation in the tissue, then we're going to have the tooth out of position, or we're going to cause some periodontal problems with the teeth by the time we get the restorations finished. So as you see here, the tissue is fairly healthy, fairly normal, even though temporaries have been in this mouth for a period of time. So the cementation of the temporaries, we would like to get the temporary cemented to place with enough temporary material to hold it to place, and yet be able to clean off the temporary material away from the gingival tissue and create a good environment for the tissue. Now the temporaries, in re-cementing them or cementing them to place, should be organized in a logical fashion. So get the temporaries out and line them up the way that they should go in the mouth. The temporaries can be cleaned off nicely in the mouth if they are coated with a coat of lubricant. So take the temporary and, using a little lubricant such as Vaseline or silicate cement lubricant, and cover all the axial surfaces of the acrylic. We're going to cement these to place with temp bond, which gives us about 1,000 pounds of strength. And we want to be able to clean this off of the temporary after we get it cemented to place. Temp bond gives us around 1,000 pounds. If the temporaries come off, we should check the occlusion, or we can use a heavier cement, such as your 2200 cements. So while the dental assistant is loading the temporary, here again, don't need to put an awful lot of material in the temporary. Enough to seal it in place while the assistant is loading the temporary. You can be drying out the mouth. The tooth doesn't have to be absolutely dry. Just relatively free of moisture. Put the temporary to place. Close, please. Bite down. And use the opposing occlusion to seat the temporary. Now, if we were going to seat the full mouth to the temporaries again, we would seat opposing quadrants of temporary so that the occlusion can be used to, open please, to seat the temporary in place. Close, tap, tap. Notice that there isn't a lot of temporary material, open please, running all over the place as we cement the crown in place. There's a nice little bead of temporary material that comes out from around the temporary. Close, please. Open. Close, please. Open. As you can see here, there's a thin bead. It's well to be able to see the cement coming around the margins. If you don't see the cement coming out around the margin of the restoration, you might not have a good seal. If you don't have a good seal on the temporary, you could create a sensitive tooth. I don't think in the period of time that we're talking about you would create any problems with decay, but you sure could have a sensitive tooth. Okay, close, tap, tap, right down. Now with all the temporaries in place, we just let the material set up to a crisp consistency, then we will clean it out. You're deaf, not doing any. When the cement sets up, you can check this by seeing if it breaks away cleanly from the temporaries. Go around each one of the teeth. I like to use a scaler to go around the teeth and get rid of this cement. It's very important to get rid of the cement. Now this can be a very painful procedure. Should be done very, very carefully. As you can see, these tissues are still not back to normal from our impression procedure. There's still more hemorrhage than you would normally have. Then go in the embrasures with an explorer and make sure that you get all the material out of there. Especially on temporaries that are luted together. Remember that the patient cannot get in between the teeth to clean out the temporary material, so you must get the material cleaned out. Material left in the sulcus, temporary material left in the sulcus could irritate the tissue and cause the inflammation. So we can go ahead now and clean out the rest of the temporary cement. You want to continually observe the tissue response to the temporary restorations. You will be removing the temporaries several times during the procedure, and you want to remove or observe the reaction of the tissue to the temporaries. So every time you take the temporaries off, check each restoration and the tissue around the tooth. As you see here, these temporaries have been on for quite a while, and we've got pretty healthy tissue. So when you take the temporaries off for procedures of impressions, for taking bites, for transfers, and so on, always check the contour and the relationship of the temporary to the tissue and maintain a healthy situation. The temporaries are often neglected, but can be the key to success of any restorative case. To sum up the purpose of the temporary and the key points of the temporary, the main functions of the temporary is to protect the tooth naturally. If the temporaries leak, you're going to get sensitive teeth and may result in some pulpal damage to the teeth. The second and probably one of the most significant factors is the maintenance of occlusion and maintaining the teeth in the position that you recorded when you took the impressions. If you do good occlusion on the articulator and the transferred cast, and the teeth are shifting and moving around in the mouth, the restorations, it's obvious, are not going to fit back in the mouth the same way as they fit on the articulator. So a lot of remounts or unnecessary adjustment of the occlusion can come from the change in position of the teeth while the temporaries are in the mouth. So the maintenance of the occlusion and the position of the teeth is vital in the temporary restoration. Also, the tissue must be maintained in a healthy condition, and this can't be emphasized too much. You should continually be looking at the tissue, maintaining the tissue in a healthy state. So you can see from the tape and this presentation that the temporaries are a very important part. Well-made temporaries restorations can be the key to success in the restorative case.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.